So, Dr. Gulani, I was told my whole life that I had mutant-shaped eyeballs and wouldn't be able to do contacts, wouldn't be able to do surgery. And I guess I just feel really fortunate that I found you, because on the one hand, I want to tell everybody, go find someone who can do this, but I know a lot of doctors aren't really qualified to take care of someone like me. But how would I tell someone, to find someone like you? How are they going to know whether they really can have the surgery or not? Because I was always told they couldn't.
Sure. Karen, you had what is called high astigmatism, very high astigmatism, close to 6 diopters. And what happens with that is many doctors, even though they do perform LASIK, incidentally, they have not trained themselves into the entire spectrum of laser vision surgeries. So there are techniques by which someone like you can be corrected, not the routine LASIK surgery, because you don't want to chop a cornea like yours, because it's it's shaped like a football. Extreme football, actually, right? It should be like a basketball, completely spherical. So, like I always talk to doctors, and I even talk to all of you patients in the rooms when I see you before surgery. Actually, LASIK is only one among many laser vision surgeries, which are among many vision corrective surgeries. So when a surgeon knows all the vision corrective techniques, he can surely work out a technique that is best for Karen, given her safety and long-term goals. So even though you had high astigmatism, you are correctable. And in your case, we did the advanced laser vision surgery without cutting or chopping your cornea. And today you're 20/20, so I'm thrilled. And all of our patients are done very well with high astigmatism. So, I mean, if you want to go a little deeper, because I know you did all your research before you came to me, your astigmatism could be something that you're born with, like you said, you knew you had it. There are people who have surgeries which land into high astigmatism. Even they can be corrected. Patients with previous LASIK gone bad, or patients with previous cataract gone bad, or patients with previous transplants. They can also be corrected with the laser. So astigmatism is correctable, but of course make sure you see your eye doctor and find out if you're a candidate. Make sure they're selecting the best technique for you, keeping your safety in mind and long-term goals. And of course, as far as research, Karen, I'm a stickler for patients doing their research, and I encourage you. And there's lots of information online out there if you read about it. On our website, I've tried my level best to educate patients, so there is no hype of call now, here's the deal. That's what I don't like about surgery. It's something serious, and if planned properly, it does result in great outcomes like yours. So you tell me, Karen, how do you feel? I mean, you're an avid trainer, you're on horses, computer, you're a very active person. You see distance and near now. Have you seen the difference?
It's amazing, and my whole life with astigmatism, it was, with that, if I have glasses, it has to be perfect. It has to be adjusted just right, or I would get these weird headaches, and things would look wavy, and I said my goal coming in here was just to get rid of that enough that I could have normal glasses prescription. So to be able to not wear glasses is amazing, and safety-wise for me, being around horses, not having pieces of metal and glass on my head, I think is really good, really good, and less sweat and things like that. So it's just been really freeing, and I think people with astigmatism aren't really understood, even at opticians. They don't know what I'm going through. I get glasses and they say, you just have to get used to it. I'm like, no, you gotta just, so it's, I think, a lot of times, we're just sort of told, oh, well, they're a difficult client, and no, you can't deal with that. And just to know that there's this world that can open up, literally, it's just amazing. And you get to wear all the cool cheap sunglasses, which I now have, many pairs of, depending on my mood, which I could never do before.
Oh, excellent. And again, you remember the discussion we had. In cases like you, it's also important to rule out abnormal corneas. That's where we spend the due diligence and the time and making sure. So I truly believe, and if this is a message for patients with high astigmatism, there is a cure, or should I say there is a way to address high astigmatism with surgery. And it is very important to make sure that the surgery is chosen for the best outcome, as well as safety and long-term goals. So Karen, it's absolutely a pleasure to see you at this point with 20/20 vision and doing so well.
It's pretty amazing. Thank you
Congratulations.
so much.
Have fun.